Welcome back to our 3000 question series. In today's episode, we'll cover the 30 most important pharmacology questions. So let's start with the first question. A nurse is caring for a client with suspected myocardial infarction. Which medication should be administered first? This means the patient has an MI, a myocardial infarction. Which medication do we give first? Now, what usually happens in an MI? As you see in this image, a clot forms in the coronary artery. If a clot forms, the artery gets blocked. Because of that, the blood flow stops and the cells here will get damaged. This is what we call a myocardial infarction. So our first goal in treatment is to ensure this clot doesn't grow any further so that there isn't even more blockage here. Now, if we look at the options, our first option is heparin. Heparin is an anticoagulant drug, so it will prevent the formation of a clot. But a clot forms in two stages, stage 1 and stage 2. In stage 1, platelets gather together. If we talk about stage 1, what happens is that platelets cluster like this, and by gathering together, they start forming the clot. In the second stage, a fibrin mesh or a fibrin network forms around these gathered platelets, and this fibrin network stabilizes the clot. So that means there are two phases. Now, heparin doesn't work on the first phase. It works on the second phase. This means it prevents the clot from becoming stable after it has already formed. But we need to prevent the clot from forming in the first place because if it keeps growing, the blockage will get even worse. So we need a medication that stops this stage. Heparin won't stop the clot from forming in this first stage, so this would be wrong. Next is morphine. Now, what is morphine? It's an opioid analgesic, so it won't be morphine either. We usually give morphine to these patients, but for different purposes. Our goal here is to decide which medication to give first to prevent the clot from growing. We give morphine later during a myocardial infarction because it reduces the cardiac preload and decreases stress. As a result, the workload on the heart is reduced. We'll give morphine, but later on, not at the start. We also give nitroglycerin to the patient because it widens the coronary artery, which increases the blood flow, but we don't give it at the very beginning. Aspirin is an anticoagulant drug, and it works on this phase, meaning phase 1. It prevents clot formation in the early stage. So we must give aspirin. Therefore, the very first drug to be given in an MI is aspirin. You can remember it like this. First, you give the patient aspirin. After aspirin, we give nitroglycerin, which will dilate the coronary artery, increasing the oxygen supply to the myocardium within the heart. And after nitroglycerin, we'll give morphine. Our purpose for giving morphine is to reduce the patient's anxiety, decrease preload, and lower the cardiac workload, which in turn reduces oxygen consumption in the myocardium. After that, we give heparin. Heparin is given last. So this is the order in which you'll administer medications to the patient. Friends, if it's an MI patient and the question asks which medication to give first, you give aspirin. But if asked what your first action would be, then our very first action will be to put the patient on oxygen. Remember both things. If it's a myocardial infarction patient and the first action is asked, you give oxygen first. If asked which medication to give first, you choose aspirin. We'll see this in the next question. A nurse is caring for a client who reports severe chest pain, shortness of breath, and diaphoresis. The nurse suspects a myocardial infarction. This means the patient is showing symptoms of a myocardial infarction. So what is the priority nursing action? Here an action is asked, not a medication. So first, we must see that in a myocardial infarction, the heart's myocardium is lacking oxygen. So we must first put the patient on oxygen. So administer aspirin. Here, the first medication isn't being asked, it's asking what your first action will be. So the first action we must take is, you must check airway, breathing, and circulation. You've seen that whenever priority comes up, check ABC, airway, breathing, and circulation. So in this, we'll first need to give the patient oxygen because there's an oxygen deficiency. Because our heart's myometrium, the myocardium, lacks oxygen, we must provide it. So first, administer aspirin. No, that's not the priority. We'll give that later. Obtain a 12-lead ECG. That falls under diagnosis and would cause a delay, so not that either. Administer nitroglycerin. Nitroglycerin will dilate the coronary artery, but it won't be our priority here. Then there's administer oxygen. Yes, we will first put them on oxygen. So you must remember, if the first action is asked for an MI patient, the first action is oxygen. If the question asks which medication to give first, you give aspirin. You can remember this sequence like this. First, you give oxygen, and after oxygen, you give aspirin. And after aspirin, you give nitroglycerin, and after that, you give morphine. And after morphine, we can give heparin. So you have to remember this sequence. First, oxygen, so that the oxygen deficiency in the myocardium can be addressed. After that, aspirin, so that a new clot doesn't form or the size of the clot doesn't increase further. Then we'll give nitroglycerin so that the coronary artery dilates, and by dilating, the flow of oxygen or blood there increases. After that, we'll give morphine so that the patient's anxiety decreases and their preload is reduced, which decreases the increased cardiac workload. Because of that, oxygen consumption will decrease. After that, we'll give heparin so that the clot doesn't grow any further. So that was our second question.
Before we move ahead, let me take a quick moment to tell you something that could completely change your NCLEX journey. If you're serious about passing the NCLEX in just 1 week or even within a month, then the smartest move you can make right now is to enroll in our complete online NCLEX crash course. This isn't just another course, it's a shortcut, a clear step-by-step roadmap that has already helped over 100,000 nursing students pass the NCLEX with competence. And here's the most incredible part. Not a single student who completed this course has failed. Yes, that's a 100% passing rate. We built this course based entirely on the feedback and insights of thousands of nurses who've successfully cleared the NCLEX in the last 5 years. That means we've removed all the fluff and focused only on what truly matters for your exam. Here's exactly what you'll get when you enroll. You'll get 100 hours of animated crash course content designed for rapid revision, 500 hours of comprehensive recorded lectures covering all the high-yield topics, and access to 10,000 real NCLEX questions to sharpen your test-taking skills. You'll also get 500 next-gen case-based questions to strengthen your clinical judgment, along with 15 full-length practice tests that simulate the real NCLEX experience. And of course, you'll receive our complete NCLEX ebook and PDF notes, plus 1 full year of access, so you can study at your pace, on your schedule. And yes, we're currently offering a 70% discount for a very short period. Once the offer ends, it's gone. Thousands of students are enrolling in our online NCLEX course every month and passing the exam, but if you don't enroll now, you risk being left behind. Spots are filling fast and only a few seats are left. Visit our website to enroll now. Link is given in description box. Let's continue the video.
Now let's look at the next one. A nurse is caring for a client who has been prescribed Lisinopril for hypertension. Which side effect should the nurse monitor for as the most common? This means the patient has hypertension, and to treat that hypertension, we've given Lisinopril. Now, if any drug ends in pril, you should understand that the drug is an ACE inhibitor. Meaning these are angiotensin-converting enzyme inhibitor drugs being given to the patient. Which side effect should the nurse monitor for as the most common? Meaning we need to identify the most frequent side effect here. So for this patient, we mostly see what normally happens inside our bodies, which is, why was Lisinopril needed? Look, whenever hypertension occurs in our body, how does hypertension happen? Our liver produces a protein. This protein then travels through the blood. Further along, the kidney produces renin. As soon as renin is produced, angiotensinogen is converted into angiotensin 1. This angiotensin 1 then travels through the blood to the lungs, and from the lungs, ACE, or angiotensin converting enzyme, is released. This angiotensin converting enzyme then converts this angiotensin 1 into angiotensin 2. As soon as angiotensin 2 is formed in our body, it performs 3 main functions. First, it constricts these blood vessels, meaning it narrows them. When they constrict, the blood pressure increases. The second thing it does is trigger the secretion of aldosterone. When aldosterone is secreted, sodium reabsorption increases within the kidneys. As sodium reabsorption increases, water follows the sodium. Water reabsorption occurs, and because of that, the blood pressure rises again. Besides that, ADH is also secreted, meaning angiotensin 2 also triggers ADH secretion, leading to water reabsorption in the kidneys. And when water is reabsorbed, blood volume increases, which in turn raises blood pressure. But for the patient, we now need to stop this particular action. We must not give angiotensin 2 so that the patient's blood pressure doesn't rise. Since it's a hypertension patient, we need to lower the blood pressure. Then we give this patient an ACE inhibitor, meaning that because of the Lisinopril we gave the patient, the ACE that was being formed will no longer be produced. If ACE isn't formed, meaning angiotensin converting enzyme isn't produced, then angiotensin II won't be formed either. Without angiotensin II, vasoconstriction won't occur, meaning blood pressure won't rise further. Then aldosterone won't be present either. This means sodium absorption won't happen, so blood pressure won't rise. ADH won't be there, and there won't be excess ADH secretion, so water reabsorption won't occur and blood pressure won't increase. So this was our purpose for giving lisinopril, which is how it reduced the hypertension. But the AC produced in our lungs, the angiotensin converting enzyme, what it does is that there's an inflammatory agent called bradykinin in our body's blood. This bradykinin keeps traveling through the blood. But when ACE is present, this AC, or angiotensin converting enzyme, breaks down this bradykinin. By breaking it down, it means bradykinin won't be in our body in excess. If it's not in excess, it won't get trapped in the lungs. But when we've given this patient lisinopril to reduce hypertension, along with that, since it's an ACE inhibitor, it will inhibit it, so ACE won't be produced. Now ACE won't be there, meaning the angiotensin converting inhibitor enzyme won't be present. Because of that, there's no one here to break down this bradykinin now. It won't be broken down. So this means that this bradykinin will continue to travel through this blood. Bradykinin will become excessive. Its level will increase. If its level increases, then this bradykinin will enter the lungs. From here, it enters the lungs and starts attaching itself here. And this bradykinin will come here inside the lungs. After arriving, the cough receptors in the lungs, like these cough receptors, will be irritated. This irritation will lead to the production of a cough, specifically a dry cough in the patient. So this is its main side effect. Now let's see what they've provided in the options we have. So option A, dry cough. We saw that a dry cough will occur because if we've given lisinopril, it will stop the production of the angiotensin converting enzyme. If that's stopped, there will be no one to break down bradykinin, and bradykinin will accumulate in the lungs. This will irritate the cough receptors, leading to a dry cough. This means a dry cough is most commonly found here. Constipation does not occur in this. Constipation is not related to this. Lisinopril won't cause weight gain. There's no weight gain with this. Because weight gain would only happen if we had high aldosterone, which would reabsorb sodium. If sodium is reabsorbed, water is reabsorbed with it, and if water is reabsorbed, body weight increases. But we saw here that as soon as we give the patient lisinopril, angiotensin I cannot convert into angiotensin II because it has blocked or inhibited the angiotensin converting enzyme in the lungs, as its name suggests. Lisinopril is an ACE inhibitor, meaning it stops it. So since it stopped, it means it remains as angiotensin I. Angiotensin I didn't convert to 2. It didn't convert to 2. So after that, we didn't have much aldosterone production. Without it, there's no sodium reabsorption, no water reabsorption, so there's no chance of weight loss because of that. So this option here, it means there's no chance of weight gain. Sorry, there won't be any chance of weight gain. So this will also be wrong here. Bradycardia is not related to lisinopril. So we saw that whenever we give a patient an ACE inhibitor, which includes captopril, ramipril, or lisinopril, we'll see a dry cough in the patient. Let's look at the next question. A nurse is evaluating a client who has been prescribed spironolone for heart failure. Which finding indicates that the medication is effective? Meaning, the patient is being given spironolone. And now, at this point, you really have to take a closer look and see which one of these different options actually indicates that the spironolactone is truly working effectively for the patient. Let's carefully consider each possibility before making a decision. So, spironolactone is a diuretic, and this diuretic works, well, I've drawn a diagram of the nephron inside our kidney here. So inside this nephron, like this PCT, this loop of Hemley, and this is the DCT, and this is the collecting duct. Now, inside the DCT and this collecting duct, we have some cells called principal cells. These principal cells work under the effect of aldosterone and ADH. If ADH and aldosterone are present in our body, they work in response to their effect. If aldosterone comes from above, they will take sodium inside, and sodium will go in. By inside, I mean this filtrate of ours, these renal tubules. From here, sodium will enter this blood capillary right here. When sodium enters it, potassium will go out from here. So we must remember that these renal tubules, DCT, contain certain cells we called principal cells. These principal cells, in the blood capillaries surrounding them, if they pull sodium in, when they pull sodium in, they'll push potassium out. If sodium doesn't go in, potassium won't come out either. We need to remember this. So what usually happens is that when we give spironolactone to a patient, it comes and blocks the aldosterone receptors inside this principal cell. Now, when the aldosterone receptors are blocked, the aldosterone hormone won't be able to work here, and aldosterone's job was to take sodium back in from this filtrate. Now, sodium isn't going in because spironolactone has blocked the aldosterone receptors. So sodium isn't going in, which means potassium isn't coming out now. Sodium isn't being reabsorbed, which means sodium is being excreted through the urine. If sodium is excreted through the urine, then water will also be excreted. This means there's water loss. So that's our purpose for giving diuretics, to get the water out. So it removed sodium, and along with it, water was also removed. That was our purpose for giving a diuretic. This means when a patient has severe edema, we'll give a diuretic, or if a patient has heart failure, we'll also give them diuretics. Now, what happened here is that sodium wasn't reabsorbed. Since it wasn't, potassium didn't come out. So you have to remember one condition here. Now, only when sodium goes back in will potassium come out. Since sodium isn't going in, potassium won't come out. It'll stay in the blood capillaries. Now, what spironolactone did here was block the aldosterone receptor in this principal cell. Because of that, sodium couldn't come inside. If sodium couldn't come in, it means potassium won't be able to go out. Since it can't go out, it means potassium will stay inside the blood, in the blood capillary. So the potassium level will start to increase here in the blood. So this means we can say that spironolactone is doing its job, which is why more sodium is being excreted through the urine, and potassium is staying within the blood. So this is the most effective indicator that the potassium level is rising, meaning spironolactone is starting to work. That's why spironolactones are called potassium-sparing diuretics, because they spare potassium and don't let it be wasted. When we talk about loop diuretics, we call them potassium-wasting diuretics. We say that because loop diuretics work on this part of the loop of Henle, and because they work here, what happens is that potassium won't be able to go back in. They block the channels that are here, so potassium will be excreted from here. Sodium will be excreted, and potassium will also be excreted. So that's why furosemides are called loop diuretics and potassium-wasting diuretics, whereas spironolactones are called potassium-sparing diuretics. So when we want to see if spironolactone is working or not, what would be the effective way? Increase potassium? Yes, if the potassium level is rising, we can say that spironolactone has started doing its job. Decrease potassium? No, when we give spironolactone, the potassium level doesn't decrease, it increases, so it won't be decreased, so this will also be wrong. Increased sodium. Sodium levels won't increase in the blood. As we saw here, sodium is being excreted, right? Since sodium is being excreted, it means sodium levels will decrease, so this is also wrong. Increased calcium? Calcium doesn't have any relation with spironolactone.
Before we move ahead, let me take a quick moment to tell you something that could completely change your NCLEX journey. If you're serious about passing the NCLEX in just 1 week or even within a month, then the smartest move you can make right now is to enroll in our complete online NCLEX crash course. This isn't just another course, it's a shortcut, a clear step-by-step roadmap that has already helped over 100,000 nursing students pass the NCLEX with competence. And here's the most incredible part. Not a single student who completed this course has failed. Yes, that's a 100% passing rate. We built this course based entirely on the feedback and insights of thousands of nurses who've successfully cleared the NCLEX in the last 5 years. That means we've removed all the fluff and focused only on what truly matters for your exam. Here's exactly what you'll get when you enroll. You'll get 100 hours of animated crash course content designed for rapid revision, 500 hours of comprehensive recorded lectures covering all the high-yield topics, and access to 10,000 real NCLEX questions to sharpen your test-taking skills. You'll also get 500 next-gen case-based questions questions to strengthen your clinical judgment, along with 15 full-length practice tests that simulate the real NCLEX experience. And of course, you'll receive our complete NCLEX ebook and PDF notes, plus 1 full year of access, so you can study at your pace on your schedule. And yes, we're currently offering a 70% discount for a very short period. Once the offer ends, it's gone. Thousands of students are enrolling in our online NCLEX course every month and passing the exam, but if you don't enroll now, you risk being left behind. Spots are filling fast and only a few seats are left. Visit our website to enroll now. Link is given in description box. Let's continue the video.
A nurse is preparing to administer morphine to a client reporting severe pain. Which parameters should the nurse assess first before administering the medication? So, before starting morphine for the patient, which parameters should we look at? Now, morphine is an opioid analgesic. It causes some sedation, and because of that, the CNS becomes a bit depressed. And when this depression occurs, our respiratory centers also get depressed. As a result, the respiratory rate will decrease. So whenever we have to give morphine to a patient, we must check the respiratory rate beforehand. If the respiratory rate is less than 12 breaths per minute, then we will withhold this medication. So looking at the options, what will we check first? What will we assess before giving the medication? Pain. There is no need to check for pain. Blood pressure. Morphine doesn't have a very significant effect on blood pressure. It can cause mild hypotension, but there's no need to check it initially. Respiratory rate. Yes, we definitely have to check the respiratory rate because it decreases the respiratory rate. If it decreases, it's possible the respiratory rate might drop significantly. So we have to keep in mind that if the patient's respiratory rate is less than 12 breaths per minute, we will withhold the morphine. That's why you should always check the respiratory rate. There's no need to check the temperature before giving morphine. A nurse is preparing to administer naloxone to a client. For which condition is this medication primarily used? So why is naloxone given to a patient? That's what this question is asking. Naloxone is the antidote for opioids, specifically for opioid analgesics. So why is it given? For sedation? No, it's not given for sedation. Morphine or other opioids are given for sedation. This actually works in the opposite way. So that means we won't give it for sedation. Pain relief? Naloxone isn't given for pain relief either because opioids are the ones used for pain relief. Opioid overdose. Yes, when there is an opioid overdose, that's when we give naloxone so that a reversal can occur. The respiratory rate that had decreased can then increase again. The sedation the patient experienced, the patient can recover from that sedation once more and be reversed. So naloxone is administered in cases of an opioid overdose. Anxiety. Naloxone is not given for anxiety. To reduce anxiety, we give opioids such as morphine. A nurse is preparing to administer glucagon to a client with an altered level of consciousness. For which condition is this medication primarily used? So glucagon is being given to the patient, and the patient's level of consciousness is altered. The question asks for which condition this medication is primarily used. We give glucagon to a patient when they are unconscious. For a patient with diabetes mellitus, if they become unconscious due to hypoglycemia, that's when we administer glucagon. We give the glucagon injection. We give glucagon either intramuscularly or subcutaneously in that situation. We will either give it IM or we will give it subcutaneously. As soon as we give glucagon, it acts on the liver. Inside the liver, glucose is stored, and it's stored in the form of glycogen. So this glycogen will be converted into glucose, and then the glucose will enter the blood vessels. Because of that, the blood sugar level in the patient will increase again. As soon as the blood sugar level rises, the patient will regain their consciousness. So the question asks why glucagon is given to an unconscious patient with diabetes mellitus. It's given when there is hypoglycemia. So option A, high blood sugar, meaning when blood sugar is high. No, if the blood sugar level is high, we won't give this. Hypoglycemia? Yes. If there's hypoglycemia and the patient is unconscious, we give glucagon to raise the blood glucose level. Hypertension? Hypertension and glucagon have nothing to do with each other. Bradycardia also has nothing to do with glucagon. A client is providing discharge teaching to a nurse is providing discharge teaching to a client who has been prescribed rifampin for tuberculosis. Which statement by the client indicates a correct understanding of the medication? This means the patient has TB and we've given them rifampin. Now, it asks for the correct understanding. Correct understanding means we need to identify the correct statement from these options. So the drug rifampin is an anti-tubercular drug, and it contains a pigment that is not yellow, it's an orange-red colored pigment. So as it gets metabolized inside the body, the metabolites that are formed, when they eventually leave the body, whether it's through urine, tears, or sweat, they actually turn those bodily fluids into the exact same color as the original pigment. This happens because the pigment remains present in those fluids as they exit the body. For example, when rifampin is excreted in the urine, the red and orange pigment it contains turns the urine that color. This is normal. So let's look at the options. My urine may turn orange in color. This means the patient said their urine might turn orange while taking rifampin. Yeah, that's a correct statement. Since we need to find the correct statement, this one will be the right answer. This medication will cause constipation. No, it's not related to constipation. This drug may cause low blood sugar. It's not related to blood sugar either. I should avoid sunlight exposure. Rifampin doesn't cause photosensitivity either. So that means the correct statement here is that the patient's urine color can turn red or orange. A nurse is administering IV vancomycin to a client with a severe infection. During the infusion, the client suddenly develops flushing of the face, neck, and upper torso, along with itching and mild hypotension. What is the nurse's priority interpretation of this finding? Meaning the patient is being given IV vancomycin. And while this IV vancomycin is being given, the patient suddenly has flushing of the face. There's flushing on the neck as well, and it's on the upper torso too, meaning the upper body. Along with itching, meaning there's itching, and mild hypotension has also occurred. So what will the nurse think is happening to the patient? This vancomycin is an antibiotic. But when we give vancomycin to a patient quickly, rapidly, our mast cells, the mast cells, secrete histamine. And that histamine is an inflammatory mediator. It goes and dilates the blood capillaries a bit. When it dilates, the blood, meaning the blood cells, the RBCs, will come out of the blood vessels, meaning the blood capillaries. If the RBCs come out of the blood capillaries, then the patient, our patient, will start turning red. This means the entire person will start turning red. So a man is changed into a red color, which means we call this red man syndrome. So the first option is red man syndrome. This means it's happening because of red man syndrome. Besides that, histamine was secreted in the patient. This means histamine is not anti-allergic. It's an inflammatory mediator. Since it's an inflammatory mediator, the patient will also start itching. And when the capillaries dilate, it means the patient will also have mild hypotension. So what caused this to happen? Because of red man syndrome, blue skin discoloration doesn't happen. Giving vancomycin fast doesn't cause alopecia, meaning hair loss either. Weight gain is not related to this. So when we give a patient vancomycin rapidly, there are chances of red man syndrome occurring. Because giving it too fast causes histamine to form in the mast cells, and because of the histamine, the patient gets red man syndrome. A nurse is caring for a client who has been prescribed an aminoglycoside antibiotic, such as gentamicin. Which of the following is the most important toxicity the nurse should monitor for? So when a patient is given aminoglycosides, what is the most important toxicity that is likely to occur in them? Look, when we give aminoglycoside antibiotics to a patient, which include gentamicin or tobramycin, what do? They go inside our kidney, so in this kidney. In this PCT part, they will start accumulating inside the cells here. Aminoglycosides will start accumulating here. If they start accumulating here, they will damage the cells in this area. When these cells are damaged, then these PCT cells, the debris will start accumulating here. And once the debris accumulates here, it means the PCT lumen will start getting blocked. Now, if it's blocked, the filtrate that came down from above, which was passing through here, won't be able to move forward properly. This means it'll start flowing backward now because it can't go forward. So it will go back and the pressure here will increase. Now there was hydrostatic pressure here too. And now there's pressure here as well. Previously the pressure here was higher and the pressure here was lower. Because of that, it was being filtered and the filtrate was moving forward from here to become urine. But if the lumen here is blocked, this fluid starts to flow back because of the blockage. So the pressure increased here too, and since the pressure was already high here, the pressure on both sides became equal. So it won't filter, meaning there will be no filtration. This means the GFR, the glomerular filtration rate, will decrease. It will decrease, meaning if it's not filtered, the blood comes in from here and goes right back out. Among the waste products are blood urea nitrogen and creatinine. Both of these will increase. Creatinine, so blood urea nitrogen and creatinine. Both of these will keep traveling through the blood. This means waste products will keep circulating in the blood. That's why when we give a patient aminoglycosides, a renal function test is definitely done to see how their kidneys are functioning. So in the patient, if we give more aminoglycosides, what will happen then? These damage the kidneys, which means they damage the nephrons. This means these are nephrotoxic drugs. Besides damaging the nephrons, these go into our ear, to the inner ear, like these semicircular canals that maintain balance. This is our cochlea, which is responsible for hearing. Inside it, there are hair cells. The aminoglycosides start damaging these hair cells. If it starts damaging them, it means the patient will also start experiencing hearing loss. So this vancomycin is ototoxic. Oto means related to the ear. So it's ototoxic and also nephrotoxic, as the signs of toxicity here relate to the nephrons. This means it's also nephrotoxic. Now let's see what options we have. So the first option is hepatotoxicity. No, so aminoglycosides were causing ototoxicity and also nephrotoxicity here. So it doesn't cause hepatotoxicity. Nephrotoxicity, here we saw that it was damaging the nephrons, which means nephrotoxicity. It doesn't cause cardiotoxicity. Aminoglycosides don't cause neurotoxicity either. Let's look at the next question. A nurse is providing discharge teaching to a client who's been prescribed tetracycline. Tetracycline is an antibiotic. Has been prescribed tetracycline for a bacterial infection. Which of the following instructions should the nurse include? Meaning, when a patient is given tetracycline, what instruction will you give? Take the medication with milk. Tetracycline should never be taken with milk because tetracycline is an antibiotic. It combines with the calcium found in milk to form an insoluble particle, and after that, it can't be absorbed. This means if we give tetracycline with milk, it won't be absorbed. So it should never be given with milk. Avoid sunlight exposure. Yes, tetracycline is a photosensitive drug. This means if a patient goes into even a little sunlight after taking tetracycline, their skin will start getting damaged. So that's why we tell the patient to avoid exposure to sunlight. So this would be the correct instruction here. Take the medication at bedtime. We avoid giving tetracycline at bedtime because whenever we give it at bedtime, when the patient lies down, regurgitation might occur, which could burn the esophagus, causing irritation, or as we'd say, start irritation within the esophagus. So whenever this medication is given, we tell the patient that after taking it, they should either walk around, stand, or sit for at least 30 minutes. We don't tell them to lie down immediately. So this will also be incorrect. Crush the tablet before taking. Whenever we give tetracycline, we never tell them to crush the tablet, because if we crush it, it'll be in powder form, and when taken, as it goes through the esophagus to the stomach, powder particles will stick to the esophagus. Because of that sticking, there will be irritation again. So we won't do that either. This means that tetracycline is a photosensitive drug, so we must protect the patient from sunlight exposure. A nurse is providing health education to a client who has been prescribed oral contraceptive pills, OCPs. Which of the following is the most serious risk associated with this medication? This means the patient is being given oral contraceptive pills, so what is the highest risk associated with them? When we give oral contraceptive pills to a patient, these oral contraceptive pills contain a combination of both estrogen and progesterone, and estrogen also plays a small role in coagulation within the body. This means it increases the risk of coagulation. So let's see which one has coagulation here. Infection? No, contraceptive pills don't increase the chances of infection. The chance of infection is mostly in patients who take steroids for a long time. Thromboembolism? Yes. Thromboembolism, meaning inside the body. The chances of a clot forming will increase. This means there will be a chance of a thrombus forming in the patient. So this will be the correct answer. Hypoglycemia? No, oral contraceptives don't cause hypoglycemia. The chances of kidney failure with contraceptives are also very low or non-existent. A nurse is providing discharge teaching to a client who's been prescribed prednisone. Prednisone, which is a steroid for the long-term management of an autoimmune condition. Which of the following adverse effects should the nurse identify as the most significant long-term risk? Meaning, if a patient is given prednisone, what risk is associated with it? Prednisone works like cortisol, and cortisol will always increase sodium reabsorption and water reabsorption in the patient. Edema can also occur, and this prednisone, what it does is it also reduces immunity. It'll do this. It won't affect the production of white blood cells much, but it interferes with the functions of the white blood cells that are formed, so their functions will decrease. This means the white blood cells won't be able to fight off infections. So in this case, our immunity will decrease. Now, weight loss? No. Whenever prednisone is given, there's no chance of weight loss. Instead, there's a chance of weight gain because it acts like a steroid or cortisol. And cortisol always causes sodium reabsorption, so it'll collect water along with it. It'll retain water. If it retains water, there's a chance of edema in the patient, and they'll gain weight rather than lose it, so this means it's wrong. Immunosuppression? Yes. If we give steroids for a long time, the patient's immunity will be somewhat suppressed because prednisone has interfered with the white blood cell's ability to function. This means the patient will have a higher chance of infection and will experience immunosuppression. Hypotension? Hypotension doesn't occur when giving prednisone because there's a higher chance of hypertension when prednisone is given, as it reabsorbs both sodium and water. This increases blood volume, and increased blood volume means a chance of hypertension, not hypotension. Bradycardia is not related to prednisone. A nurse is providing medication teaching to a client who has been prescribed levothyroxine. Levothyroxine is a synthetic thyroid hormone, or synthetic T4, or we can say it's a synthetic thyroxine hormone for hypothyroidism. Which of the following instructions should the nurse include regarding when to take this medication? This means when levothyroxine is prescribed to a patient, when will you tell the patient to take it? Take the medication at night? No, we won't give levothyroxine to the patient at night because it's a hormone. And hormones in the body are mostly at their peak in the morning. This means we have to match it with the body's natural rhythm, the circadian rhythm. That is, we should give hormonal tablets at the same time the body is naturally producing hormones. So we won't give it at night. Take the medication before a meal? If we give this medicine, levothyroxine, to the patient right before a meal, the chances of its absorption will decrease, meaning absorption will be lower. So we won't give it just before a meal. Take the medication in the morning on an empty stomach. Yes, whenever levothyroxine is given to a patient, it should be given on an empty stomach and in the morning. This solves both our purposes, because in the morning, thyroxine hormone is naturally being produced in our body, so we need to match the synthetic hormone we're giving externally, levothyroxine, with that. So first, we'll give it in the morning, and second, we'll give it on an empty stomach, which will increase its absorption. So this will be the correct answer. Take the medication after a meal? We won't give it after a meal either, because if we give it after a meal, its absorption will be interfered with.
Before we move ahead, let me take a quick moment to tell you something that could completely change your NCLEX journey. If you're serious about passing the NCLEX in just 1 week or even within a month, then the smartest move you can make right now is to enroll in our complete online NCLEX crash course. This isn't just another course, it's a shortcut, a clear step-by-step roadmap that has already helped over 100,000 nursing students pass the NCLEX with competence. And here's the most incredible part. Not a single student who completed this course has failed. Yes, that's a 100% passing rate. We built this course based entirely on the feedback and insights of thousands of nurses who've successfully cleared the NCLEX in the last 5 years. That means we've removed all the fluff and focused only on what truly matters for your exam. Here's exactly what you'll get when you enroll. You'll get 100 hours of animated crash course content designed for rapid revision, 500 hours of comprehensive recorded lectures covering all the high-yield topics, and access to 10,000 real NCLEX questions to sharpen your test-taking skills. You'll also get 500 next-gen case-based questions to strengthen your clinical judgment, along with 15 full-length full-length practice tests that simulate the real NCLEX experience. And of course, you'll receive our complete NCLEX ebook and PDF notes, plus 1 full year of access, so you can study at your pace on your schedule. And yes, we're currently offering a 70% discount for a very short period. Once the offer ends, it's gone. Thousands of students are enrolling in our online NCLEX course every month and passing the exam, but if you don't enroll now, you risk being left behind. Spots are filling fast and only a few seats are left. Visit our website to enroll now. Link is given in description box. Let's continue the video.
A nurse is providing medication teaching to a client who has been prescribed atorvastatin, a lipid-lowering agent, statin, to manage hyperlipidemia. Atorvastatin, since it's a statin, means it's a medication used to lower lipids. A lipid-lowering agent to manage the hyperlipidemia. Which of the following adverse effects should the nurse instruct the client to report immediately? This means we've given the patient a medication called atorvastatin to lower their lipid levels. But which side effects should we tell the patient they need to report immediately? So, first, option A, muscle pain. Yes, whenever a patient has muscle pain, we must tell them to report it right away, because muscle pain occurs because this atorvastatin, besides doing its main job of lowering lipids, it also causes muscle breakdown. If it breaks down the muscles, let's say these are the muscles we have. If it breaks them down, then myoglobin will be released, and this myoglobin will go and get stuck in the nephrons found inside the kidneys. Because when it gets stuck in the nephrons, there's a higher chance of kidney failure. So this means the filtering ability of the kidney will decrease because of this, increasing the risk of renal failure. So we call this condition. So this atorvastatin lowers lipids, but it also causes the breakdown of muscles, specifically skeletal muscles. And so a new problem is created, which we call rhabdomyolysis. Lysis means breakdown, myo means muscle, and rhabdo means skeletal. Skeletal muscle breakdown, when skeletal muscles break down in the body, a protein called myoglobin is released into the bloodstream. This myoglobin then travels to the kidneys where it can get stuck in the tiny filtering units inside the kidneys, and as a result, it reduces the kidney's ability to filter waste from the blood efficiently. And because of that, the chances of kidney failure will increase. So we need to avoid this right from the start, meaning prevent it. So when this begins, the patient will start experiencing muscle pain. So we have to tell the patient that as soon as they feel pain in their muscles, they must inform the doctor immediately. So this will be the correct answer. Cough? Atorvastatin doesn't cause a cough. We've mostly seen coughs with the ACE inhibitor drugs we looked at a little while ago, like Lisinopril, Captopril, Enalapril, or Ramipril. All of those will cause a dry cough. This means that atorvastatin will not cause a dry cough here. Diarrhea isn't related to this, and atorvastatin doesn't cause fever either. A nurse is providing discharge teaching to a client who has been prescribed phenytoin, an antiepileptic, anticonvulsant medication for seizure control. This means we're giving the patient antiepileptic drugs to control seizures, specifically phenytoin. Which of the following adverse effects should the nurse include in the teaching? This means the main side effects should be mentioned in the teaching. So, hair loss. Phenytoin doesn't cause hair loss, which means this will be incorrect. Gum hyperplasia. Yes, when we give phenytoin to a patient, our gums, meaning the patient's gums, start accumulating collagen fibers. If collagen fibers accumulate there, the size of the gums will increase. And if the gum size increases, it means we call it gum hyperplasia. Hyperplasia means an increase in size. So the size of the gums will increase, and the gums will look as if they are bleeding. Along with this, a nurse's responsibility also increases, and that is when we tell the patient to toothbrush, we will tell them to use a soft toothbrush. Otherwise, there will be chances of bleeding. So when phenytoin is being given to the patient, there are chances of gum hyperplasia. So this means we will give education to the patient related to this. So here, this will be the correct answer. Weight loss will not happen. In this, dry cough is also not associated with phenytoin. A nurse is reviewing the medication list of a client who has been prescribed diazepam, meaning the patient is being given diazepam. Diazepam, a benzodiazepine that is a CNS depressant, meaning diazepam is being given, which belongs to the benzodiazepine category and depresses the CNS. The nurse understands that this medication is primarily used for which of the following conditions, meaning why do we give diazepam? To reduce pain? No, it's not given for pain. It's given to reduce anxiety, so anxiety will be the correct answer here. It's also not given for hypertension or for infection. A nurse is preparing to administer metoprolol to a client with hypertension. This means metoprolol is given, and wherever lol appears, it means this drug is of the beta blocker category. Wherever lol appears, it means it's of the beta blocker category, such as atenolol, metoprolol, propranolol. So this means these are beta blockers, which means they will also reduce the heart rate. It reduces hypertension, and besides that, it also reduces the heart rate. So, which parameter should the nurse assess first before administering the medication? That is, if the patient has hypertension, metoprolol is prescribed for them, but before starting this, which vitals will the nurse check? So, we must remember that for all these drugs that we call beta blockers, which have lol at the end, we have to check the pulse. That if the pulse in the patient is less than 60, then we have to withhold this medication, not give it, because it will cause more severe bradycardia in this patient. So respiratory rate is mostly not checked in metoprolol. We check respiratory rate when morphine is given to the patient. So here, this is wrong. Blood pressure doesn't need to be measured right now, but the pulse is definitely measured in this. There's no need to measure the temperature either. A nurse is caring for a client who has been receiving lithium for bipolar disorder. Lithium is being given to the patient. For bipolar disorder, bipolar means that the patient is going into mania for some episodic periods and into depression for others. This means at times they become very active, and at other times they go straight into depression and their activity slows down completely. Which finding indicates toxicity? That is, in which of these conditions can we say that lithium toxicity has occurred? Lithium is given to stabilize the mood in patients. That is, for bipolar disorders, especially in patients with mania, we give lithium to stabilize their mood. But when we give lithium, we must remember one thing. Lithium always acts like sodium in the body, so lithium behaves like sodium in the body. So whenever we give lithium to the body, or rather the kidneys in our body, sense it as if it were sodium. So remember that lithium behaves like sodium. Mostly, sodium goes to our neurons in the brain and helps with signal transmission there. But when we give lithium to a patient, lithium also acts like sodium. So this lithium goes into those neurons, taking the place of that sodium. Now, we'll also perform the same function, but it isn't sodium. This means it won't function properly like sodium did. Consequently, it will cause abnormal impulse conduction. It'll cause abnormality, meaning the patient's movements won't be coordinated, smooth, or controlled. This results in fine tremors. The patient will start having these slight movements, but the question here is, which one is a sign of toxicity? So, having fine tremors when a patient is given lithium is considered an expected finding. So, we can assume that lithium has now reached the neurons in the brain and has started working there. So, fine tremors are always considered expected. Most students mistakenly think right here that if there are tremors, it means toxicity. But it's not toxicity. Fine tremors are an expected sign when lithium is given to a patient. We can assume it has entered the brain and started its work. So we need to identify toxicity. Nausea can also occur in patients, but it's not necessarily toxicity. Confusion, however, means that neurological symptoms have now started appearing, because if the lithium level is elevated, it means the brain is becoming more affected, which will lead to confusion. If there's confusion, it means toxicity has started to set in, increased thirst. In this case, we also can't say that this isn't a sign of toxicity. A nurse is caring for a client who has been receiving Digoxin for heart failure. That is, Digoxin is being given for heart failure in a heart failure condition. The client reports nausea, anorexia, and states that I'm seeing yellow halos around the lights. So this means when the patient is given Digoxin, they're experiencing nausea, anorexia, and the patient says, I am seeing yellow halos around the lights. What is the priority nursing action? This means whenever a patient is given Digoxin and toxicity occurs, the first symptoms to appear are GI related, such as nausea and vomiting. After that, in the eye, specifically in our retina, the cells found there have a sodium-potassium pump, and the digoxin goes and binds to it. Because of that, an electrolyte imbalance occurs within these cells. There will be a sodium-potassium electrolyte imbalance. Due to this imbalance, a distorted image is sent. This means the image doesn't form properly, and any light that is there, the patient sees a yellow light or yellow halo around any object. So this confirms that the patient now has digoxin toxicity. So what's the first thing we'll do? Whenever a patient has digoxin toxicity, we withhold the digoxin, because if there's digoxin toxicity, it will cause bradycardia, and if bradycardia occurs, the patient's heart could potentially stop. So if there's significant bradycardia, we must intervene beforehand. If the patient is an adult and their heart rate is less than 60, if it's below 60, we will withhold this medication, this digoxin. If the patient you are caring for happens to be a child and you find that their heart rate is less than 70 beats per minute, then we will need to withhold the medication Digoxin. On the other hand, if the patient is an infant and their heart rate is found to be less than 90 beats per minute, we will also withhold the medication in this case. So, considering this information, what do you think will be the most important or priority nursing action to take in this situation? Administer potassium as prescribed. Administering the prescribed potassium isn't going to resolve these issues. So, we don't need to administer it right now. Check the client's serum digoxin level. The digoxin level should be checked, but if we do that now, the necessary intervention will be delayed, so this won't be our priority action. Administer the atropine. Atropine is mostly given for bradycardia, but nowhere in this question is it indicated that this patient has bradycardia, so we won't give this either. Withhold the next dose of digoxin. Yes, we will withhold the next dose of digoxin so that the toxicity doesn't increase further and the patient doesn't develop signs of severe toxicity. A nurse is providing dietary teaching to a client taking lithium, meaning if a patient is taking lithium, what dietary instructions will we give them? Which statement indicates correct understanding? This means we need to identify the correct statement here. Our answer will be the correct statement. So, whenever we give lithium to a patient, their sodium level should never be low, because our body or kidneys treat lithium as sodium, believes. So this means if there is a sodium deficiency in our body, then sodium here in the kidney tubule, which through the urine here, from the filtrate that was formed here, sodium comes back here into the blood. If sodium is low in our body, then sodium will come back. From these kidney nephron tubules, it'll come back into the blood capillaries. It will enter the capillaries like this, but along with sodium, lithium will also come. Because we saw this at the very beginning, that lithium behaves like sodium. So this means the kidney now thinks that this lithium is also sodium. So if there's a sodium deficiency in the body, the kidney will then start taking in lithium as well. So lithium will be reabsorbed from here again. Meaning the extra lithium that was supposed to be excreted through urine, instead of going out, gets reabsorbed and enters the blood. If lithium levels in the blood become too high, it'll lead to toxicity. This means we must never let a sodium deficiency occur in the patient, because if it does, the kidney will reabsorb it from the nephrons to compensate. So lithium also works, also behaves like sodium. Thus, lithium will enter the blood, increasing lithium toxicity. So we will always tell the patient to maintain proper sodium levels. So we'll tell the patient to maintain a consistent sodium diet. So we have to identify the correct statement here. This means the patient's correct statement. So I will follow a low sodium diet. No, we shouldn't give a low sodium diet. We must maintain a consistent sodium level in the blood to prevent excessive lithium reabsorption. So this is an incorrect statement. I will increase potassium intake. Potassium has nothing to do with lithium. This is also incorrect. I will maintain consistent sodium intake. Yes, keep the sodium intake consistent so that there's no sodium deficiency in the body. I will avoid magnesium foods. Magnesium has nothing to do with this. So you must remember that whenever a patient is on digoxin, we maintain their potassium levels. We won't let a potassium deficiency occur because that would lead to digoxin toxicity. But when a patient is on lithium, when lithium is being administered, we will maintain consistent sodium levels. We won't let sodium levels drop, otherwise lithium toxicity will increase. So remember, whenever a patient is on lithium, we'll maintain their sodium diet so that sodium levels don't drop and lithium toxicity doesn't occur. When a patient is on digoxin, we maintain potassium levels to prevent hypokalemia and subsequent digoxin toxicity. A nurse is providing discharge teaching to a patient prescribed warfarin. Warfarin is an anticoagulant. Which statement indicates a correct understanding of the medication? Correct understanding means the correct statement will be our answer. When warfarin is given to a patient, it's an anticoagulant, meaning it prevents excessive blood clotting in the body to avoid DVT. It's given for such conditions. So we need to identify the correct statement here. I will eat more green vegetables. If the patient eats more green leafy vegetables, they contain vitamin K, which goes to the liver and increases the production of clotting factors. If clotting factor production increases, the risk of clots also goes up. But what is our purpose? Why are we giving warfarin? We give warfarin so that clots don't form in the patient. So that means we won't give the patient a diet rich in vitamin K. Therefore, this is an incorrect statement. I will take aspirin for pain. If both warfarin and aspirin are anticoagulants, taking them together increases the risk of bleeding in the patient. So this is also an incorrect statement. I will use a soft toothbrush. Yes, if a patient is on warfarin, there's a higher risk of bleeding because it thins the blood, which leads to an increased chance of bleeding. So when the patient brushes, we must tell them to use a soft toothbrush. This means it's a correct statement. So this will be our answer. I will stop the medication if bleeding occurs. If bleeding occurs anywhere, we must inform the doctor, and then the doctor can stop it. So our correct statement is, I will use a soft toothbrush. A nurse is caring for a patient receiving a continuous IV infusion of heparin for the treatment of DVT. This means heparin is also an anticoagulant given for the treatment and prevention of DVT, or deep vein thrombosis. The client develops signs of excessive bleeding. This means the patient is showing signs of significant bleeding. Which medication should the nurse anticipate administering? This means when a patient with DVT is given heparin, and because of that heparin, they develop signs of excessive bleeding and start bleeding. So what will the nurse anticipate being prescribed for this patient now? What will the doctor prescribe for this? So we need to give something, a medicine that stops the bleeding. So vitamin K is mostly the antidote for warfarin, okay? Not for heparin. So that means this will also be wrong. Protamine sulfate? Yes, the antidote for heparin is protamine sulfate. So here we'll give the patient protamine sulfate. Naloxone. Naloxone is the antidote for morphine, so this would also be wrong here. Atropine is mostly given if there's organophosphorus toxicity, acting as its antidote, although it's also used to increase the heart rate if it's too low. But if we're talking about antidotes, and these are all antidotes, then atropine is the antidote for organophosphorus. Organophosphorus is mostly found in pesticides, and if a patient ingests them, causing bradycardia, we can give the patient atropine. As an antidote, a nurse is preparing to administer insulin Lispro to a client with diabetes mellitus. That is, Lispro insulin is given to a patient with diabetes mellitus. When should the nurse administer this medication? So when will we administer Lispro to the patient? 20 minutes before a meal. We won't do it 20 minutes before a meal because Lispro is a rapid-acting insulin. This means it starts working immediately, within 10 minutes. It starts working within 10 minutes, so this is rapid-acting. Just like Lispro, there's another insulin called Aspart. Aspart and Lispro are both rapid-acting and start working within 10 minutes. So whenever we give this insulin, it's very important for the patient to have food so that after giving it, after taking the injection, the patient doesn't go into hypoglycemia. So we shouldn't wait for 20 minutes, otherwise the patient will develop hypoglycemia. Immediately before a meal, yes. This Lispro and the not short, but rapid-acting insulin should only be given to the patient when food is immediately available to the patient. So that means we will give it immediately before a meal.
Before we move ahead, let me take a quick moment to tell you something that could completely change your NCLEX journey. If you're serious about passing the NCLEX in just 1 week or even within a month, then the smartest move you can make right now is to enroll in our complete online NCLEX crash course. This isn't just another course, it's a shortcut, a clear step-by-step roadmap that has already helped over 100,000 nursing students pass the NCLEX with confidence. And here's the most incredible part. Not a single student who completed this course has failed. Yes, that's a 100% passing rate. We built this course based entirely on the feedback and insights of thousands of nurses who've successfully cleared the NCLEX in the last 5 years. That means we've removed all the fluff and focused only on what truly matters for your exam. Here's exactly what you'll get when you enroll. You'll get 100 hours of animated crash course content designed for rapid revision, 500 hours of comprehensive recorded lectures covering all the high-yield topics, and access to 10,000 real NCLEX questions to sharpen your test-taking skills. You'll also get 500 next-gen case-based questions to strengthen your clinical judgment, along with 15 full-length practice tests that simulate the real NCLEX experience. And of course, you'll receive our complete NCLEX ebook and PDF notes, plus 1 full year of access so you can study at your pace on your schedule. And yes, we're currently offering a 70% discount for a very short period. Once the offer ends, it's gone. Thousands of students are enrolling in our online NCLEX course every month and passing the exam, but if you don't enroll now, you risk being left behind. Spots are filling fast and only a few seats are left. Visit our website to enroll now. Link is given in description box. Let's continue the video.
So that food is immediately available. So that means we'll give it immediately before a meal. This will be the correct answer. An hour after a meal, if we give it an hour after a meal, then in the patient, the chances of hyperglycemia will increase. So this will also be wrong. At bedtime, we don't give this rapid-acting insulin at bedtime because there'll be an immediate risk of hypoglycemia in the patient. At bedtime, we give insulins that are long-acting. Long-acting mostly includes glargine, which we call Lantus. What happens is that its onset of action is within 1 to 2 hours, and then it doesn't have a peak. This means it works consistently for 24 hours. Since there's no peak, there are no chances of hypoglycemia. So at bedtime, we give long-acting insulin, like glargine or what we call Lantus. And we have another insulin, which we call regular insulin. This regular insulin is short-acting. Short-acting insulins mostly start working within 30 minutes. A nurse is teaching a client who's prescribed isotretinoin for severe acne. Which statement by the client indicates a need for further teaching? So the patient is being given isotretinoin to treat acne. And when will we provide further teaching? When does the patient need further teaching? This means when further teaching is mentioned, it implies that an incorrect statement will be our answer here. We'll see what acne actually is. In our skin, there's hair. These are the hair follicles. Connected to these hair follicles are some glands called sebaceous glands. These sebaceous glands produce oil, and as this oil production continues, the skin remains oily. But due to some hormonal effects, if oil production increases significantly, then oil production will increase greatly, and along with that, this entire area will become sticky. Additionally, the cells here get damaged and debris accumulates. Debris will collect, more oil is being produced from one side, and more debris from the other, causing this area to get blocked. If it gets blocked, it means the chances of infection in the back will increase and inflammation will occur. With inflammation, a bump-like structure forms on the skin, which we call acne. To treat this acne, we give the patient isotretinoin. Isotretinoin comes and acts on this sebaceous gland. It will reduce the production of sebum from here. If sebum production is reduced, then oil production will decrease and sebum production will decrease. So now the infection here will decrease, and because of that, it will start to heal again. But what is being asked here? We need to identify the incorrect statement that indicates the patient needs further teaching. So the incorrect statement, I will avoid pregnancy during treatment. So when we give isotretinoin to a patient, this isotretinoin is a teratogenic drug. If a woman becomes pregnant during that time, the organs in the fetus will develop abnormally. This means it's a teratogenic medication. At the time when the patient is undergoing acne treatment where isotretinoin is prescribed, pregnancy must be avoided during that time. So I will avoid pregnancy during the treatment. This means this is a correct statement. We need to find the incorrect one, so this option is wrong. I should expect dry skin and lips. Dry skin and lips, as we saw that. Isotretinoin works on the sebaceous glands and reduces sebum production. This means it reduces oil production. Reducing oil production means the skin will become dry. So this is also expected. This means this is a correct statement from the patient, so this will also be wrong here. I can donate blood while taking this medication? When a patient is on isotretinoin medication, they cannot donate blood. Because if they donate blood and the recipient is a pregnant woman, this isotretinoin can enter her system and cause teratogenic effects in the fetus. So this means this statement by the patient is wrong. Since it's a wrong statement and we need to identify the incorrect one, this will be the correct answer here. I will have regular blood tests to monitor my health. To monitor my health, I should have blood tests. Yes, they should. This is a correct statement. A nurse is caring for a client with asthma who is prescribed the following inhalers: albuterol and budesonide. Which medication should the nurse instruct the client to take first? This means the patient has asthma, and we have prescribed 2 inhalers for that asthma patient. One is albuterol and the other is budesonide. Which medication should the nurse instruct to take first? So which one will be given first? So albuterol is a bronchodilator and budesonide is a corticosteroid. The bronchodilator will dilate the bronchioles in our lungs, and the corticosteroid, which is budesonide, will go inside and reduce the inflammation in the bronchioles. So we first need to give the medication that dilates first, so that the steroid we give, meaning the budesonide or corticosteroid, can easily reach deep into the lungs. So that means first we give the bronchodilator, and after that we give the corticosteroid. So you have to remember, first comes A, then comes B, and then comes C. So now you can rule out A. You'll give B first, then C. This means you'll give the bronchodilator first, followed by the corticosteroid. So now let's see which option comes first. Budesonide? No, we won't give budesonide first. We'll give the bronchodilator first. So this is wrong. Both at the same time? We won't give both together either, as it would reduce their effectiveness. Order does not matter? That's also incorrect. The order matters because we must give the bronchodilator first, then the corticosteroid. So this is also wrong. And option D is albuterol. Yes, we'll give albuterol first. Giving albuterol means bronchodilation. The bronchioles will dilate. So the steroid we give after that will easily reach the lungs, and its effectiveness will increase. A nurse is teaching a client how to apply betamethasone cream for eczema. For eczema, a skin disorder, betamethasone, which is a topical corticosteroid, has been prescribed. Which statement by the client indicates correct understanding? Correct understanding means the correct statement will be our answer here. Whenever betamethasone is given to a patient, what should we do? I will apply a thick layer. No, if we apply a thick layer, then its absorption from here will increase. More absorption means higher chances of toxicity, so a thick layer shouldn't be applied. I will cover the area with a tight dressing after applying. Covering it with a tight dressing after applying betamethasone would also be wrong, because if we cover it, the chances of absorption will still increase, which could lead to betamethasone toxicity. I will apply a thin layer to the affected area. Yes, whenever we give a topical steroid or give topical betamethasone to a patient, a thin layer is applied. It's both safe and effective. So this will be the correct statement, and since that's what's being asked, the correct answer here is C. I will apply it to broken skin. If we apply it to broken skin, absorption will again be higher. And because the skin is broken, there will also be irritation when we apply betamethasone. So this is also an incorrect statement. A nurse is caring for a client taking metoclopramide. Which side effects should the nurse monitor? If metoclopramide is given to a patient, it's for nausea and vomiting, but which side effects should the nurse monitor for? Constipation? Now, Constipation isn't caused by metoclopramide because metoclopramide goes to our brain and lowers dopamine levels. So it lowers dopamine levels. Normally, the more dopamine there is in the body, the less our GI tract moves. So they'll decrease, but if we give metoclopramide, it'll lower dopamine levels in the brain. This means intestinal movements will increase, so constipation won't occur. So this one's wrong. Bradycardia in option D, it won't cause that either, and it won't cause hypertension. This medication, metoclopramide, causes extrapyramidal symptoms. Extrapyramidal symptoms mean extra, as in out, pyramidal, from the pyramid, and symptoms. We call these extrapyramidal symptoms EPS. In EPS, symptoms like Parkinsonism appear, and the patient develops tardive dyskinesia. So in these EPS symptoms, what happens is the patient will start having tremors, rigidity will increase, and akathisia will occur. The patient will experience restlessness, meaning the patient is never at rest. They just remain restless. So these are EPS, extrapyramidal symptoms. What are they exactly? Look, to explain this, we need to look at our brain. Inside the brain, this area is the motor cortex. From this motor cortex, many nerve fibers emerge. These motor nerve fibers come out, and further inside the brain itself, they form a pyramid-like structure. After forming this pyramid-like structure, they then go on to reach our skeletal muscles and facilitate our voluntary movements. So the voluntary movements we need to perform, like this pen sitting right here. Now, if I want to pick up this pen, that's my voluntary control over it. So when I pick it up, that's my voluntary control. So what made this happen were these nerve fibers. But these nerve fibers join together inside the brain to form a triangular structure. We call a triangular structure a pyramid. This means the nerves coming out of this pyramid are what we call the pyramidal tract. So these will handle voluntary movement, and if this gets damaged, the patient will suffer from paralysis. But some nerve fibers don't pass through this pyramid. They don't form a pyramid. They are outside the pyramid. Outside means extra. Since they're outside the pyramid, it's called the extrapyramidal tract. This extrapyramidal tract controls fine movements. Fine movement means once a movement has started, it looks after its smoothness and its coordination. Suppose this pen is here and I want to pick it up. This means it's under my voluntary control. So this was done by voluntary movement, which means the pyramidal tract made it happen. But while picking up this pen, how will I pick it up? Will I pick it up smoothly or properly? I picked up the pen like this. This is okay, but when I go to pick up this pen, tremor and all the way there. This means the coordination isn't good. Movements are happening, but the coordination isn't good. The smoothness isn't good. Then I'll grab this, pick it up, and now I've made this movement, but it's abnormal. This means it's called fine movement, or smooth movement, or coordinated movement. This is controlled by our extrapyramidal tract when we give the patient low. When we give the patient metoclopramide, it lowers the dopamine levels in the brain, and if the dopamine level decreases, then this tract, the extrapyramidal tract, gets affected. Because of that, its movements, its role will be affected, and then it won't be able to perform those fine movements. So because of that, some symptoms appear in the patient, like increased rigidity, or the patient might develop tardive dyskinesia or akathisia. Akathisia means restlessness in the patient. They'll start having tremors like in Parkinsonism. So we call all of these extrapyramidal symptoms. So whenever extrapyramidal symptoms appear in a patient, it means it's a side effect of metoclopramide. And when these occur, when our extrapyramidal tract is affected, only the fine motor movements in the patient will be affected. But if the pyramidal tract is damaged, then voluntary movements will be affected, meaning the patient will have paralysis. A nurse is caring for a patient receiving loperamide for acute diarrhea. Which finding indicates the nurse should hold the medication? This means which of these findings, if seen, would cause us to withhold loperamide. Loperamide is given to control diarrhea, so decreased frequency of stools. If the frequency of stools decreases, then that's good. That's exactly what we wanted, because we want to reduce the frequency of stools. This means we can say that loperamide is working effectively. So we need to identify the sign of toxicity here. So this one will be wrong. Mild fatigue isn't related to this. Dry mouth isn't related to loperamide either. But if we give loperamide and the patient has abdominal distension, we withhold loperamide immediately because it might stop intestinal movement. If intestinal movement stops completely, the intestinal contents will stay right there in the intestine, and there will be a chance of intestinal obstruction, which could then lead to intestinal perforation in the patient. This means if the abdomen is distended, if there's abdominal distension in the patient, then we must withhold loperamide immediately. So this will be the correct answer. A nurse is caring for a client prescribed allopurinol for gout. Gout means if there is a patient, the uric acid level in their blood increases. And then these uric acid crystals form. They start collecting in the joints. We call that gout. Which statement by the client indicates a need for further teaching? This means the gout patient is being given allopurinol. Now, which statement by the client indicates the need for further teaching? Further teaching means we need to find the incorrect statement. So whichever statement is incorrect will be our correct answer. So this medication will reduce my uric acid level. Yes, this is a correct statement, because when we give allopurinol to a patient, it lowers the uric acid level. So that's a correct statement, but we need to find the incorrect one. So that means this is the wrong answer here. I should drink plenty of water. Yes, when a patient has gout and is given allopurinol, they need to drink a lot of water so that the uric acid can be flushed out through the urine. This is also a correct statement, so a correct statement won't be our answer here. This medication is used to prevent gout attacks. Yes, when allopurinol is given to a patient, it's to prevent an acute gout attack from happening again because it slowly lowers the gout levels. It's given so gout doesn't recur. So this is a correct statement. This will be our answer, right here. No, sorry. We need to find the incorrect statement. So that means this won't be the answer either, because this is a correct statement. If it's a correct statement, that's not what's asked, right? It says further teaching here, which means we need the incorrect statement. Whereas in this one, it says, this medication is used to prevent gout attacks. Yes, the medication is given to prevent gout attacks, so it's a correct statement. That means it's wrong here. I will take this medication during an acute gout attack for pain relief. This statement is incorrect, and the incorrect statement is our answer. So that means this will be our answer here. Option D, this is the answer because the patient is saying that when they have gout pain, acute pain, they will take allopurinol at that time, but that's not how it works. Allopurinol isn't given to relieve pain. Allopurinol works slowly over a long period, and it lowers the uric acid level. It doesn't reduce pain or inflammation. When a patient has immediate pain or inflammation, we give them a medicine called colchicine, or we give them non-steroidal anti-inflammatory drugs. So this is an incorrect statement, and our answer is option D. So those were today's 30 pharmacology questions. See you in the next episode, where we'll discuss 3,000 questions. And you can also head over to our website and enroll in our course as well. We're offering a 70% discount on that course, and inside you'll find all the NGN case study videos along with 5,000 to 10,000 questions. You'll get an ebook and plenty of recorded lectures that you can watch whenever you want on any topic you'd like to study. We're offering a 70% discount, so go check it out. The link is in the description. Thanks, and see you tomorrow in a new video.